The opioid epidemic. It's a crisis that's devastated countless families here and across the country. But what's causing it? How can we fight it? And the options available if you or someone you love needs help.
This is not an urban or rural issue, and there is no stereotype that fits a drug user. It could be your friend, your neighbor, a loved one, or even the person sitting right next to you who is addicted to drugs.
Well, hello everyone, and welcome to this Fox 9 special. Over the past few years, we've been dealing with a crisis. Opioid abuse has skyrocketed, and it's taking a tragic toll in countless families. And today we want to explore some of the causes of this epidemic and how you can help a loved one who might be struggling with this. Look, we know this is not easy, right? Hundreds have already died, but many more have also survived. Cindy Woldstead is one of those survivors. Her addiction to opioid painkillers started back with an injury almost 8 years ago. She's been sober now for nearly 3 months, and she told me recently that she wasn't the only one who suffered.
I was so blinded. When you're on pain pills and you're drinking all the time, trying to act normal and balance yourself out, I was so blind to the fact that my family was suffering. They were suffering watching me.
And Cindy told me that her message is that she's alive and that she has a chance to live. And you know, for many of us, the scope of this opioid epidemic really hit home when we lost Prince. Nearly 1 year has now passed since Prince was found dead at Paisley Park. He died of an accidental fentanyl overdose. Now, fentanyl is a highly powerful prescription painkiller used to treat severe pain. In fact, it's about 100 times more potent than morphine. Well, following his death, friends of Prince said that he had been suffering from knee and hip pain from years of performing. And you know, none of this is happening in a vacuum. We know from Prince that this epidemic knows no social, it knows no ethnic, it knows no income boundaries. This has affected families across our state, even lawmakers too. One of them is Representative Dave Baker from Wilmer. He lost his son Dan, and I talked to him about it inside the House chambers. Tell us about your son Dan, because a couple of days ago you called him a great man.
He was a great son, and when you say it like that, I'm reminded so many times of what I miss about Dan.
Dan Baker was just 25 years old when he died from a heroin overdose, a street drug, because he'd run out of opioid painkillers.
We think about him every day, my wife and I, and we wish we had him here to physically hang on to and maybe see his beautiful children that he never had, or meet his beautiful wife that he's never had as well.
But his story starts like so many other people's stories in that it began with an injury.
It did. It was just a back injury. We think it was back from a hockey injury or a softball injury, and it just started with a back pain. Went to the doctor, and our doctor was very clear. Be very, very careful with this. These are very good drugs, but they're also very addictive, and so be careful with this.
It's a story told again and again. As the medical community has counted the pain pills, families have counted the losses. Losses that are poster memories at rallies crying for action.
To talk about this horrible disease that we're all so familiar with.
Tragically, Representative Baker is one of 2 state lawmakers touched by the opioid epidemic. There's also Senator Chris Eaton, who lost her daughter Ariel.
Every day I miss my daughter, and every day I wake up without her.
It's why Senator Eaton, along with Representative Baker, are introducing a package of bills called the Opioid Reform Act. Among them, a 30-day cutoff in filling opioid prescriptions after a doctor writes the script. Another requires pharmacies to inform patients on the dangers of opioids. And a third requires doctors to check a patient's record in the prescription monitoring program, often called the PMP.
Before they see a patient or while they're helping a patient, what we're asking the doctors in one of our bills is to, at a refill moment, when you start giving somebody an opioid after 30 days, we're asking you to take a look at the PMP program. And that's when my moment of clarity came, because I had no idea.
Representative, what about some of the critics who may say, look, legislators and laws should not get in the way of doctors doing their job to help people manage pain and get better outcomes?
If we don't stand up and start telling them by law now you have to do X, Y, and Z, our fear is they're not going to do it.
Representative Baker admits none of the proposed legislation will solve the opioid crisis, but he believes it's a start, and just perhaps a voice for his son and other victims of opioid overdoses.
I feel like that's why I'm supposed to be here. I feel like Dan is always looking over his dad and saying, I think you're doing the right thing here, Dad, because again, I would have never wanted this to happen. I know it was an accidental overdose, and I think about that all the time, but I'm here because I need to be his voice for so many families that have shared with me their terrible losses. And it's so heartbreaking when I see these continuing. I'm here for a reason. I don't know always what that is, but I think today, in this moment, I'm here to talk about this on behalf of my son and all the families that have lost loved ones, and we need to do something, and I think this is a really good start.
Representative Dave Baker, thank you so much for your time. Best wishes to you.
Thank you so much.
Now, this all leads to a couple of questions. One, just how bad has the opioid epidemic become? And two, what are some of the biggest causes? Well, Karen Scullin spoke to the chief medical officer at Hazelden Betty Ford to get some insight.
Let's first of all kind of start off with where we're at with opiate addiction. You mentioned that it should be better, but it really hasn't gotten better.
Yeah, there's still an increasing number of people using opioids across the country, but in particular here in Minnesota, the numbers from first quarter 2015 to first quarter 2016 kept rising. Opioid overdose deaths kept rising here in Minnesota. Part of that's been a switch from prescription opioids to heroin. So now there's people that use either or both because heroin is an opioid and can do the same thing for them, but it's often cheaper than the prescription opioid.
What's happening that it's not improving?
You know, physicians have started to change, but there's still a lot of physicians who either resist change or don't really recognize the problem for what it is. In medical school, we get about 8 hours on average of training about addiction. And so whenever a physician's faced with something they don't know much about, they don't like to admit that or talk about it, especially with a patient, right? Because they're supposed to know everything about the issue. And often they don't have many other options. So they'll provide the opioid in spite of the fact that it could be a risk. When you start going into withdrawal, you have more pain. It may not be the pain that started the problem in the first place, but opioid withdrawal is painful. So you think it's your old pain, so you start to decrease it, you get pain, you go back up. Try and convince your doc you need more because you got pain again. So that's an issue. Patients believe they work. You take the patient's description of pain as their reality because we can't figure it out. There's no way to determine that. So we have to use just their subjective description. However, acute pain, like I broke a leg or I had surgery, the opioids are fantastic. They work. You only take them for a short period. Most people only need them a few days and they can be done with them. And that's not a very risky use, and it's extremely necessary too. But chronic pain, the long-lasting over 3 months worth of pain, you know, from a low back problem or some other issue, that's where the opioids don't work as well. And yet medicine shifted in the mid-90s to start using opioids for that type of chronic pain. As a result, we got a whole lot of people using them long-term.
It sounds like, one question, that you could ask a patient before prescribing them opioids is, do you have any addiction in your family?
Yeah, it'd be the perfect question to ask, and it's seldom asked, unfortunately. And we're trying to teach physicians now that that's a necessary piece. There's really a shift in how we're viewing the treatment of pain within the halls of medicine, and I think that will limit the numbers of people exposed to these really powerful medications over time. It's going to take time.
We've got more to come on this Fox 9 Community Connection special. Coming up next, we're going to hear from Attorney General Lori Swanson about a new public awareness campaign designed to hopefully save some lives. Plus, what law enforcement he is doing to prevent all of these tragedies. It's all coming up when this special continues. As we go to break, a startling statistic about the demographics of the opioid epidemic. According to the Steve Rumler Foundation, 25 to 34-year-olds had the greatest number of deaths from overdoses in the first half of last year. We'll be right back.
Mike, I'm heading out to run some errands. Better get up soon. Mike, don't you have to go to work? Mike. Honey? Are you listening to me?
Mike, get up. Mike, wake up. Michael, get up. Honey, get up. Mike, baby, wake up.
Sobering message there. Welcome back to this Fox 9 Community Connection special. What you just watched there was a PSA for a campaign called A Dose of Reality. This is all designed to educate everyone about opioid abuse. Our Amy Hawkert talked to Minnesota Attorney General Lori Swanson about the campaign and what else we can do to help people in need.
She is on the front lines in the battle against opioid addiction. Here to share her insight, Minnesota Attorney General Lori Swanson. Thank you for being here.
Thank you for having me.
So we hear words like crisis, epidemic. Can you put into perspective just how bad this problem is?
Yeah, it's opioid overdoses are the leading cause of accidental deaths now in this country. More people die from opioid overdoses than from car accidents. The number of prescription painkillers that are dispensed in the country have quadrupled since 1999, and with them, so have the number of overdoses. And it really impacts everybody, both the patient. We have over 1,000 people who go to emergency rooms every day in this country because of opioid dependency. Every single day.
Wow.
And every 25 minutes, a baby is born addicted to opioids. And so it really affects both the individual patients, but also, babies who are born to addicts, as well as families and workplaces that lose something like $25 billion every year in lost workplace productivity because patients are addicted.
That ripple effect is incredible.
It's huge, yeah.
So you recently teamed up with Wisconsin's Attorney General to talk a little bit about a new initiative, a public awareness campaign. Can you tell us a little bit about what that is and who you're hoping to reach specifically?
Yeah, the campaign is called Dose of Reality, and the idea is to kind of dispense with some of the myths surrounding prescription painkillers and provide information on how to safely use them, store them, and get rid of them afterward. Prescription painkillers can be beneficial to treating pain when they're properly prescribed and used and stored safely, but when they're abused, they can be dangerous and even deadly. What we hope to do with this campaign is give people basic information on how to store their drugs safely, how to get rid of them when they're no longer needed, and we want to provide that information not just for people who may be addicted to drugs, but also for their caregivers, their friends, their family, their children, their parents, so that people can be armed with information.
And you had said when we were talking earlier, one of the specific questions you get is, where can I get rid of, so I go through my cabinet, where can I bring these? What can I do? What are some resources for folks?
Yeah, so about 70% of prescription painkillers that are abused are gotten from friends and family for free. Somebody has a root canal, they no longer need the medication. Somebody else in the family has back pain and they just give it to a family member. You should never take drugs that are not prescribed for you because they can be really dangerous. And if you have drugs in your medicine cabinet that you no longer need, you can look on the Dose of Reality website, and there's an interactive map that will show you every place near your workplace or your home where you can take the drugs for free. A lot of local police departments will take them, a lot of pharmacies will take them for free. And so if you have medications sitting around at home, don't just leave them at home when you're done with them. Take them to one of these places and get rid of them. You shouldn't flush them down the drain. People ask about that, and they can be harmful to the environment, harmful to the water supply. So the best thing to do is take them to one of these pre-approved centers, either at a pharmacy or at a police department, and you can find those on the Dose of Reality website.
And the last thing I wanted to ask you about is, if you do suspect someone close to you, someone you know at work may have a problem, or if you feel like you may have a problem yourself, what are some first steps? What are some things you can do?
It's really important to intervene and don't try to deal with it yourself. I mean, it's very, very difficult for people to overcome this on their own. I mean, it really is very harsh effects on the body. On the Dose of Reality website, we give a lot of information. We have a whole section on how to seek help. There's a lot of places you can call to find treatment centers that are available, a lot of public resources that are available, and I would encourage people to look at that website. We have tips on the warning signs of opioid dependency. If you think somebody you care about isn't quite right, and there's a lot of kind of red flags to spotting it that people can identify through the website.
Okay, great. So write it down. Dose of Reality is the website.
Correct.
Okay, Minnesota Attorney General Lori Swanson, thank you so much for joining us
Thank
and
you.
being a part of this important initiative.
Thank you for having me.
Now, you need to know that law enforcement is stepping up its efforts not to just crack down on opioids such as heroin, but to also make sure that people get the help they need before the tragedy occurs. Fox 9's Randy Myers spoke to Hennepin County Sheriff Rich Stanek, who says all opioid deaths are tragic and all of them are preventable, too.
Hennepin County Sheriff Rich Stanek is joining us now to talk more about law enforcement's efforts to battle the opioid epidemic. First of all, Sheriff, thanks for being here. Appreciate it.
Thanks for having me and talking about this.
This is such a crisis right now. Over the past couple of years, it's really come to a head. 140 deaths in Hennepin County alone last year. Root causes, in your view? You see this every day.
You know, root causes is, I think, over prescription by doctors. The problem is these things are legally and lawfully available, so people can go in and use them if they use them the right way. It's when they misuse them and get jammed up. And by the way, we had 153 deaths last year alone as a result of opioid, heroin, overdose deaths.
Nasty. Is it also a sort of a contributing factor that it's easy to come by? As you point out, they're prescription drugs. And is it a lucrative street drug for people who are criminals that want to sell?
You know, to some degree, but honestly, you can get prescription for painkillers. At some point, though, the game is up. 4, 5, 6 times they're refilling that prescription either at your primary care, maybe urgent care, maybe an emergency room, but eventually the game is up and then people turn to the street. Sometimes they can buy prescription pain pills, but they can go out and buy heroin a lot easier. It's a lot more pure, more addictive, and a lot cheaper than buying prescription pain pills.
And I know law enforcement has had to take this on in a big way in the last couple of years as well. What is law enforcement doing to try and get a handle on this?
Sure, well, it's part of the three-legged stool. You know, we do enforcement, prevention, intervention. We're really good at the enforcement aspect, but that is not the answer to this. You've got to have it, but it is not by any means the answer. It's intervention and prevention. So law enforcement has been out, like the sheriff's office, we went out with our collective partners across our county, talked about hashtag Noverdose, trying to educate the public. In the last week, I've been out to 6 different Rotary, Lion, Optimist Club educational groups, telling them about the inherent dangers of prescription drugs and heroin.
Noverdose, I want to talk more about that because we actually did a story on that not so long ago. Drill down on that a little bit. What is it, and what is the message to the public, to those who may be touched by opioid use or abuse?
Sure. Well, I think part of the problem with opioid abuse, prescription pain pills, and heroin is that it's anonymous. And we had a 16-year-old kid last year that died all the way up to 98 years old, so it's the great non-discriminator. Hashtag Noverdose was meant to educate the public and pique their awareness about what's going on, ask those questions of kids. But it's just not just the kids, it's young adults, it's middle-aged, it's professional people, homemakers, everybody in between is affected by this. I'd venture to say many of the people listening to the show here today know friends, colleagues, nieces, nephews, employers, employees who've been affected by a prescription drug overdose or addiction.
Final question. Somebody out there seeing this, they're either an opioid abuser or they know someone who is. Advice?
Well, first is don't be shy about it, right? People have problems, people have issues, they can work through it. Go to hennepinsheriff.org, go to Hazelden, go to a collective resource and get the help that you need. It's not afraid to say I have a problem or I might have a problem. And for those that are listening, maybe it's a loved one, an employer, or an employee, same thing. People need help. Sometimes they need that outstretched hand. Give it to them.
Yeah, too often these are ending badly, and get over the embarrassment, get over the shame if that's what you feel, and get the help.
This is not by any means the end of the world. People turn their lives around all the time. People can come back from this as well.
All right. Hennepin County Sheriff Rich Stanek, appreciate you being here. Thank you.
Thank you.
All right.
Very much.
Now we're going to have more on the resources available for fighting opioid addiction coming up. But first, we have the first Noverdose Drug Prevention Town Hall. It's going to be at Wayzata High School, coming up on March 20th at 7 o'clock. The event is free, and parents and students are encouraged to attend this one. There are so many resources when it comes to getting help for yours or your loved one's possible addiction. Our special thanks tonight to Hazelden Betty Ford, the Attorney General's Office, and the Hennepin County Sheriff's Office as well. The Steve Rumbler Hope Foundation also has a lot of information on its website. I'm Tim Balance. Thanks so much for joining us for this Fox 9 Community Connection special.